Hi, I'm Mausamin Hathidara, stroke neurologist, and in today's SVINutes, we'll be discussing fundamentals of Doppler waveform analysis. Also known as spectral analysis, is essential for interpretation of vascular studies. Waveform can vary widely based on systemic hemodynamic factors or focal pathology. In today's review, we'll focus on algorithm for waveform analysis, then review the normal waveform pattern for extracranial and intracranial arteries, and then look at some examples of hemodynamic as well as focal pathology-related waveform changes. First step is to identify beginning and end of cardiac cycle. Typically, systole starts with sharp systolic acceleration, followed by stepwise diastolic deceleration. Once you've identified the beginning of cardiac cycle, pay attention to the systolic upstroke acceleration sharpness and systolic complex. Secondly, pay attention to the end diastolic velocities if that is consistent with expected resistance pattern for that arterial system. To understand the concept of resistance pattern better, we'll review this in more depth in the next slide. Then look at the transformation of the waveform from proximal to distal segment of that artery and compare it with the contralateral homologous segment. Now, before we review the normal pattern of the waveform in different arteries, let's understand the key concept of low versus high resistance. Arteries that supply to the extremities as well as proximal great arteries have high resistance pattern where there is a low component of the diastolic flow, typically less than 25%. Versus, in contrast, arteries that supply to the brain, intracranial, and precerebral arteries such as internal carotid have low resistance pattern where they have constant flow throughout the cardiac cycle, diastolic flow being quarter to half of the peak systolic velocity. Now you're looking at the example of normal waveform pattern from proximal artery of aorta to all the way intracranially middle cerebral artery, and transformation from medium to low resistance as you move intracranially. While interpreting these studies, it is very important to also pay attention to the systemic circulatory factors and hemodynamic factors such as hypo or hypertension, anemia, carbon dioxide concentration, because all of that can affect cerebral circulation and therefore the waveform pattern. Let's review some examples. Here you're looking at the high resistance waveform pattern in middle cerebral and anterior cerebral artery, where the end diastolic flow is low. This is in a patient with patent MCA and SCA. And this pattern of high resistance waveform in this patient is due to the compensatory cerebral vasoconstriction in the setting of high cardiac output as a protective phenomena. On the other end is the example of very low resistance waveform pattern in the patient with sickle cell disease, where due to anemia and lower concentration of hemoglobin, there is higher need of the blood flow, and in addition to that, due to high cardiac output, there is low resistance waveform pattern with or without focal pathology due to sickle cell. Focal lesion such as stenosis or occlusion can cause various different spectrum of waveform changes depending on the segment of insonation and spectrum of the disease. Let's review some of the common examples. In the patient with greater than 50% stenosis of middle cerebral artery, on the spectral waveform, you're looking at increased velocities, spectral broadening, as well as turbulence that you see with that yellowish color close to the baseline. Next is the example of critical greater than 80% stenosis or subtotal occlusion, where you see the dampened or blunted waveform. This being on the other end of the Spencer's curve, the velocities are lower in this scenario, and the waveform has parvus tardus appearance where there is delay in systolic acceleration and the velocities are lower compared to the contralateral side. Thank you for your attention. I hope this review of waveform analysis is helpful.